Hi, Dr. Gary Rademacher here from Downtown's Healthcare, and thanks for tuning in. We are a physical and regenerative medical clinic that has combined medicine, chiropractic, physical therapy, and massage to give a comprehensive, multidisciplinary approach to pain syndromes and musculoskeletal disorders. Services that we include, some of them are physical medicine and chiropractic, regenerative medicine, which includes your stem cell injections, other types of regenerative injections, cosmetic regenerative treatments, BioT, natural hormone replacement therapy, neuropathy treatment, personal injury care, decompression therapy, just to name a few. And so anyway, this week I found an amazing research article, which was, chiropractic reduces opioid use by 55% in low back pain. This blew my mind, and it doesn't surprise me, but at the same time, they're starting to see the research, and they're starting to see the devastating effects of opioid use and how physical medicine can actually really help people. Listen, you're not going to get rid of opioids. They are a necessary medication for people with certain types of surgeries, obviously surgeries, and to help with pain. However, it's very, very addictive, and there are many conditions that these opioid prescription should be a last resort, not a first resort. So I want to review the study according to Dr. Mark Student, Dr. William Owens. Again, is chiropractic reduces opioid use by 55% in low back pain. This research article is a report on the scientific literature. There was 11 references in this report, and there's a link below that you can click on to get more information. But I have most of it here in this video. So in the United States, of the adults who were prescribed opioids, 59% reported back pain. So according to Peterson, the prevalence of low back pain is stated to be between 15 and 30%. The 1-year period for prevalence is between 15 and 45%, and the lifetime prevalence is 50 to 80%, meaning up to 80% of the population will have back pain at some point in time in their life. Pain is considered chronic when it lasts longer than 6 months after the healing of the original injury. Chronic pain patients suffer from more than pain. They experience depression, anxiety, sleep disturbances, and decision-making abnormalities that also significantly diminish their quality of life. Now, according to Whedon, Toller, Goal in 2018, they reported that 1 in 5 patients with non-cancer pain or pain-related diagnosis is prescribed opioids in office-based setting. Your primary care provider accounts for 50% of the opioid prescriptions. And I want you to understand that a one-day prescription, one day of taking these exposes the carrier to a 6% chance of being on the opioids 1 year later, increasing by 13.5% by the 8th day of being on an opioid and 29.9% by the 31st day. So obviously, the concern here is the longer that you're on them, the addiction is much higher. And so we want to be careful with how long you're taking them. And so definitely talk to your medical primary provider if you are prescribed these. Number one, make sure that it's something that you have an exit strategy to get them off of them as soon as possible. And also, try not to get on them in the first place if you're having like joint pain or back pain, when usually it's biomechanical nature, so you need a physical solution and not actually a drug. Now, other studies, according to Day, reported that 26% of fourth-year Harvard medical students had a cognitive mastery of physical medicine. So that means 4 years of medical school, only 26% of them had really a good cognitive mastery of physical medicine. Think about that for a second. This is the reason why you have to be careful when you're seeing your primary medical provider. Yes, they want to help you. That's their purpose. However, they're not trained in musculoskeletal disorders. According to Schmall, incoming interns at the University of Pennsylvania took an exam of musculoskeletal aptitude and competence, which was validated by a survey of more than 100 orthopedic program chairpersons across the country. 82% of the students tested and failed to show basic competency. So when you understand that, when you're going to your primary medical doctor, they may not have much background at all in treating your back pain and or joint pain. They go on, with continued evidence of lack of musculoskeletal medicine and subsequent deficiency of training in spine, particularly of biomechanical orientation, the question becomes, which profession has the education basis, training, and clinical competence to manage these cases? They took a deeper look into the chiropractic education. They found that, according to the American Chiropractic Association, they have a chiropractor has 4,820 hours compared to 3,398 hours of education for physical therapy and 4,600 hours of medicine. And as a result, all accredited doctors of chiropractic degree programs focus a significant amount of time in their curriculum on the basic science courses and on musculoskeletal conditions. So they're starting to show that, hey, chiropractic should be the provider of choice for musculoskeletal conditions, and more studies are coming out on that. According to Toller, Gohl, and Kazal in 2018, recently published clinical guidelines from the American College of Physicians recommend non-pharmacological treatment in the first line approach to treating back pain, with the consideration of opioids only in the last treatment option. So what they're recommending is that your primary medical provider start referring to chiropractors, which we've known that for many years. So the above reports basically evidence-based outcomes verifying that chiropractic must be considered as the first line of referrals or primary spine care providers for mechanical diagnosis, which means that there's no fracture, tumor, or infection. The evidence also reveals that chiropractic outcomes exceed those of physical therapy medicine for mechanical spine diagnosis. Unfortunately, it has taken thousands of opioid-related deaths to bring chiropractic to the forefront and start to eradicate the medical dogma against chiropractic and consider chiropractic as the first referral option for spine. So I hope this information is helpful for you, because when I look at the studies, 8% of the population sees chiropractors and 92% go to their primary care provider, which is really dangerous when you look at and take the consideration that your primary care provider does not have the background on spinal biomechanical problems. So DHC is committed. We are adding services, and our mission is to help people avoid drugs and unnecessary surgeries. I hope this information was helpful. Please pass it on to other people. If you have questions, please call us at 303-292-9992. If you know someone suffering from back problems or joint problems, we can definitely help. If we can't, we can at least find out what's going on and refer them into the right direction of where to go. So help us help others. Please forward this on to other people so that they can learn and the truth and educate themselves on who the provider of choice is for some of these conditions. So again, thank you for tuning in. Make it a great day. And until next time, stay healthy.